Toll from COVID-19 may be 3 times higher than the official count. And here to answer your questions about that is Dr. Rick Malley, who is an infectious disease specialist at Boston Children's Hospital. Nice to see you, Doctor.
Great to see you, Doctor. Thanks for your time. So let's take a look at the numbers, and that sobering number there, 3 times as high. The World Health Organization announced today that it believes nearly 15 million people have died from COVID worldwide. That's a lot more than the 5.5 roughly deaths that countries have officially reported, a difference of almost 10 million people. How do you explain the gap? What do you think?
Well, at first, of course, these numbers are staggering and make everybody understand how catastrophic the COVID-19 pandemic has been worldwide. It's important when you look at these numbers to realize that in a lot of the countries where these tests are not available, where medical care is not quite as shall we say, immediately accessible as it is here, it's very difficult to actually ascertain who is sick, who is dying, what they're dying from. And so ultimately, we always assumed that there would be a much higher toll than what is being measured. But these numbers, of course, are much worse than many of us had predicted.
Doctors, by the way, if you need to get that,
yeah, you can mute
go
that
ahead and
if you
get
want.
that.
It's okay.
If it's urgent, if you need to get it, get it.
And I will ask this question while you're doing that. Children, as you know, have a much lower risk of death from COVID. But do you think it's likely that more kids around the world have died from the virus than we thought?
I think it's possible that the numbers are a little bit higher. Still, the mortality rate, fortunately, for children is much lower than that for adults. And therefore, I think it's probably not the order of difference that we're seeing here worldwide for overall mortality. It's also true that the death of a child is so tragic that people investigate it a lot more thoroughly, perhaps, than in other cases.
Yeah, here in Massachusetts, it seems like everyone knows someone with a kid who was tested positive for COVID. So how do the symptoms that you're seeing from Omicron compare to the ones that you saw with the earlier variants?
The primary difference we're seeing now is that a lot of children, in particular with this new variant of COVID, are experiencing what we call croup, where they have really predominant sore throat and harsh sounding cough symptoms. And that has been one of the differences we're noticing with the newer variants compared to the original disease in children.
Doctor, as you know, adults who test positive can ask their doctor to prescribe the antiviral pill Paxlovid. And we've been talking about that. Sometimes symptoms come back. But the question to you for this is there something similar available yet for kids? And do you think that's a good idea?
There isn't anything yet that is approved for children under the age of 12, for example. And therefore, there's a big gap, as you can imagine, where I think there would be a role for a medicine like this, maybe Paxlovid if it gets evaluated and is found to be safe in younger ages, or some other medication, and there are many that are being looked at right now, is in particular for children who present with comorbidities or are immunocompromised or have significant risk factors. In those children, we would be very interested, of course, in having a modality like a medication to try to provide as early as possible to see if we can try to reduce the likelihood of either a severe consequence of COVID or even mortality.
Dr. Malley from Children's Hospital, thank you so much. Stay well, doctor.
You too.
Great to see you.